Thank you, everyone, so much for joining us and for watching the film with us. So inspiring and very powerful. I want to take a minute to introduce our panel members today before we start our discussion and take some questions. First, we'd like to thank everybody for being here. First is James Keach, the award-winning filmmaker and director and producer of the movie you all just saw, Skin on Fire. Thank you for being here, James.
Thank you.
Dr. Marvin Rapaport is a practicing dermatologist and topical steroid withdrawal specialist who was featured in the film. Thank you for joining us, Doctor.
James, you made a beautiful movie. The 10th time I've seen it. Very nice.
Thank you. Thank you, Doctor.
We have Dr. Peter Leo joining us. Dr. Leo is a practicing dermatologist, assistant professor of clinical dermatology and pediatrics at Northwestern University's Feinberg School of Medicine, and the director of the Northwestern University Eczema Care and Education Center, and a member of the National Eczema Association Scientific and Medical Advisory Council. Thank you so much for being here with us. Next, we have Kathy Tullos, the president of ITSAN. Kathy, thanks for joining us.
Well,
and we have Lauren Dupree, who's a TSW patient and was featured in the film that you just saw. Thank you, Lauren. All right, well, we're excited to have a little discussion here. I want to start with James. James is the filmmaker who made the film. I'd love for you to tell us a little bit about when you first learned about topical steroid addiction and what led you to make a documentary about it.
Well, I had the opportunity to play golf with Dr. Rapaport, and he asked me if I'd ever heard of anything called topical steroid withdrawal or addiction. And I said, "What are you talking about?" And this is a very similar process that I've gone through with film. When somebody asked me about when I did Glenn Campbell, I'll Be Me, it's about Alzheimer's. They said, "Do you want to make a movie about a guy with Alzheimer's?" I said, I had no idea what Alzheimer's was. I had no idea what topical steroid addiction was. And as a filmmaker, when I don't understand or know about things, it makes me very curious to find out. And what I found out was absolutely staggering to me. I mean, and then when I started doing the research on it and looking into Dr. Rapaport's work and discovering people like Lauren online, and it just blew my mind, and I had to make the film. I just said, somebody needs to communicate this to the world because it's a big secret that needs to be known about. And I hope we accomplish that. So.
Absolutely. Thank you. A question for Dr. Rapaport. You have been fighting the good fight against topical steroid addiction for decades. Have you seen any positive movements towards a more widespread acknowledgement of TSW, whether it's within the medical community or outside of it? And what do you hope to see happen in the near future?
Well, I had thought when I wrote 9 papers that were published in peer-reviewed journals over 30 years that the doctors would call and change. No. I had thought that with the movie there would be a grassroots movement to make the doctors change because letters would be written. So far, no. I had thought there would be physicians, dermatologists who would see the reality and the positivity of the facts. I haven't really seen that yet, and I'm concerned. I do not understand why change is so difficult when it's so logical.
Yeah. Question next for Dr. Leo. The TSW community is eager for the medical establishment to acknowledge TSW as a medical condition and has heard rumblings of updated guidelines from the American Academy of Dermatology regarding topical steroid use. Do you have any light you could shed on the subject and what may be expected from these new guidelines?
It is such an important question. So I'm not on the guidelines committee this year, so I don't know exactly what they're working on. I certainly hope they're putting some consideration of TSW into the guidelines, but I will say that there are some really important signs that it is actually making its way to the mainstream. I'm seeing more and more papers talk about it as a differential diagnosis, more and more papers bringing it up, and it's bringing it up in a way that's not just a paper about TSW, which is important, but those can be ignored. When it comes in a more mainstream paper and is part of the general discussion, it's being normalized. So I mean, Dr. Rapaport's been doing it a lot longer than I have been. But when I first started talking about it 7 or 8 years ago, I feel like nobody knew what I was talking about. Now, when I talk about it, people sit up, people tell me, yes, I have patients that are similar. So I really think the awareness and understanding is making it mainstream, although I know it's not as fast as any of us wish it were.
Right. And you work with pediatric patients, which brings us to our next question. For Kathy, what has it been like for you to be the caregiver of a child with TSW? And then could you tell us a little bit about how you first got involved with ITSAN?
Sure. My background is I'm a registered nurse and I worked in pediatrics. And so I was pretty familiar with how to give treatments and carry out treatment plans. I'm the mother of 4 children. They all had eczema. I had eczema growing up. So none of this was foreign to me. But one of my children, my son, Rhett, he went through TSW, and at the beginning stages, it was just extremely frustrating because it was just didn't look anything like the eczema I was used to that I'd seen in my other children. His creams we used for about 3.5 years. And toward the end, it was just getting less and less effective. And then it started to kind of turn to not just was it not working, he's in pain, he's burning, water, air, clothes. And so just like this isn't normal, but nobody was really acknowledging it. I was just, being referred to now a pediatric derm who just said it's worsening eczema. This is what happens. More steroids, higher potency, use it for longer on more areas. And we were just kind of seeing more of the same of, he was still in pain. So I did some research. I found a handful of peer-reviewed articles. And that's what I was looking for, was good information. What are doctors saying about this? And I found a bunch of Dr. Rapaport's work. And to be honest, if I hadn't, I wouldn't have believed people in some of these groups, saying this is happening to me, because I just had to have that medical backing. So I would come to my appointments with research in hand, and doctors didn't want to look at it and just kind of, poo-pooed it. Extremely frustrating. And so long story short, in 18 months time off steroids, my son was clear. And kind of back to where we started, where sometimes he will have mild eczema patches, but most of the time he's clear. And the patches are in little spots, like maybe behind his knees or across his ankles. When he went through TSW, it was full body, not a clear spot on his body from his scalp to his feet. And so, once he cleared up and I felt like I had a leg to stand on and none of his doctors would report me for non-treatment, I really got active in ITSAN, and I asked, could I work on the website and putting some of this research on so that we look more credible, and so that if doctors come across this, they'll be able to easily find what they're looking for. And so that was in 2015, I joined the board. In 2019, I became president. My son's almost 13 now, and he's still clear.
I feel like that gave you the ability to do your own research in a way that a lot of parents or patients are not able to, or they may try, but have a harder time really processing and synthesizing the information they come across. So I know you were sort of towards the end of what you were saying, and I hope that everybody caught most of it, but is there anything else that you wanted to add at the end of I'm so glad to hear that your son is 8 years clear of TSW. That's amazing. And thank you for the work that you do on the board. Is there anything else you want to share?
Just to wrap up, the questions that we're still trying to answer are, why does
Why does this happen to some people and why it doesn't to others? And why in 3.5 years on treatment, he got so severe, and why in 18 months off treatment, he's clear again. I don't think I even know the answer to that. I just observed this. And then I'm observing it in the last 8 years in our groups. Even that is not true for everyone. There's some real long haulers. And so not everybody has this experience. And so we need to find answers for everyone. And so that's something ITSAN is trying to do, is create a patient registry where we can answer some of these questions. How many people have this? What does it look like? How did we get here? And that's something that, you know, will be coming out in the future. But I think that's pretty much it to wrap up.
Yeah, well, you mentioned long haulers, and before Lauren, we have a question for you. But before we get there, I just want to follow up on the long haulers and ask Dr. Rapaport to weigh in on that. You consider long haulers people who go beyond 3 to 5 years. Is that correct? And do we know why? Why do those people not clear in 3 to 5 years?
Am I on? Can you hear me?
Yes, we can hear you.
Okay, we've gone over and over again the same. The film showed all of the background. We know the diagnosis, we know the treatment, we know the cure, period. There's no further things that have to be looked into. Why does it last that long? One of my papers showed that nitric oxide is released by the vessels in the skin, and that chemical opens up blood vessels, so blood flow will go to the brain. So when people are in accidents and in a coma, they won't die of no blood in the brain. This chemical opens up the vessels and releases nitric oxide. I did a well-balanced, perfectly pondered study about nitric oxide. We have the answer. What are we going to do now? We've gone over and over again in the past. We don't need to hear that anymore. I want to know why the psychology of the docs are that way. There was a man named Semmelweis, a physician in Vienna in the 1840s, an obstetrician in the biggest lying-in hospital in Vienna. The doctor ward, the death rate was 50%, and on the nursing ward, the women who delivered, it was 12%. He pondered there's some difference, and it was observed by him that they did autopsies on the dead women in the morning and delivered the women in the afternoon. So he pushed for them washing their hands in phenol before they delivered. He ultimately committed suicide because he couldn't get the idea across. There are other situations in medicine. This is not unusual. This is a truculent event in the realms of medicine, and change is exceptionally difficult. So we have to look at that and the psychology of the severity of these lives being taken away. So when Kathy, you say why, this is the skinny. It takes 3 to 5 years. I do not have the answer, but they're all cured after that period of time. When it's a child who's been putting it on for 8 months, it takes about 18 months and they're cured and they don't have rash anymore. That is the answer. What do we do to change the minds? The film was supposed to do that with the help of my papers. It has not worked. So I asked the doctors why.
My next question is for Lauren Dupree. Lauren, how long have you been living with TSW, and can you describe your journey?
Yes. Yeah, it's been an interesting journey. So I've had eczema since I was a baby. And in 2012 was when I first started TSW, but I didn't know what was going on. And so I went to the dermatologist. This is when I started getting light patches, and the dermatologist was asking if vitiligo ran in my family. And I was like burning and itching. And so I went to the dermatologist and they put me back on steroids. And I made a lot of changes to my diet. I thought that's what I needed to do to heal. And then in 2014, while I was using the steroids, I was using steroids probably like on the insides of my elbows and my hands mostly. I was using like a tube a week just for those two spots. And I was dealing with these full body flares that would just happen. I would get really flaky, and then it would kind of just like shed. My eyes would get swollen, and then I would be fine. But I was on the steroids while this was happening. And so at that point, I just decided to find a natural way to heal, because I was like, what's the point of using the steroids if I'm going to deal with these full body flares. So then I went through topical steroid withdrawal. It probably took around like 8 to 10 months to even find the term topical steroid withdrawal. I actually found the ITSAN website, and I saw pictures of all these people who were breaking out in the same areas as me. And I just knew, like, okay, this is what I'm going through. And I went through that for probably almost 2 years, but I was still working full time. I was an actor. I was like doing shows. And it just got to be too much, and I was trying to find relief. So I started another, it's called the Dr. Aaron Regimen, which is topical steroids diluted in moisturizer with an antibacterial to combat the staph infection that people with eczema or topical steroid withdrawal commonly get. And I was on that for about 2.5 years, and it worked at first. And then it didn't. And it repeated the same cycle of having to get stronger and stronger prescriptions. So in April of 2019, I stopped using that, and I haven't used steroids since. And in like the summer of 2020, I was almost completely clear, but right now I'm dealing with a full body flare that's been going on for like 4 weeks. So this is the worst my skin has been in years. I was questioning whether I was still going through topical steroid withdrawal or if it was just eczema, but now it's clear it is still topical steroid withdrawal.
Oh, wow. Oh,
Yeah.
well, I'm sorry you're going through it right now, but glad to hear Dr. Rapaport say that, it does go away in 3 to 5 years at the most, right?
You need help, you need appropriate medication, and you can function. And there are the basket cases, the terrible problems. I put on cyclosporin, an immunosuppressive drug, 700-800 patients, and they're all cured. And they function and they live. They don't suffer. So there are methods for treating while you're going through withdrawal, not to sit back and hide. And that's what is being talked about, and I find it totally inappropriate.
And Dr. Rapaport, are you saying that anybody over the 5-year mark, there's still hope and that this is the treatment that you would prescribe?
No, you have to show me those patients. They do not have it the past 5 years. Invariably, they have thickened skin from scratching, and they think it's still the same problem. It's the third diagnosis. It's not eczema. It's not red skin syndrome. They have to be looked at. Okay? So there's lots of suppositions out there that are totally wrong.
Wow. Yes. So that was a question from the audience, which is interesting. It feels like there's sort of another piece of this that people are dealing with, and more information to share.
They need appropriate medical care.
And what do you, this was a great question. I want to circle back to this one. The question is, how can community better support folks who are dealing with TSW? I guess if we want to hear first from Kathy or Lauren, who've been through it, any thoughts on what's the best way that community can support you or somebody who's going through this?
I think maybe it depends on what community we're talking about. So I'll direct it to the medical community. I think first and foremost, it's believing your patient.
To piggyback on that, there was another question before that somebody wanted to know, what is the best way for patients to advocate for themselves when a doctor is really pushing steroids? And I know you mentioned before you'd kind of been through this, where you brought research with you to a doctor. You brought Dr. Rapaport's papers. These are peer-reviewed studies. What do people do when the doctor that you go to is just like, no, steroids? What do you recommend?
I would say sometimes you have to find common ground. And so for me, I said, this is the one thing I don't want to do any more of. We did 3.5 years of steroids. This is where we landed. It's a terrible place. We'll try something else. So for us, we even tried UVB phototherapy. I'm looking at the light unit in my room still. We tried, just other things. And I just wanted to make it clear, that I wasn't, running away from medical care. I also took him to multiple specialists. I'm not kidding, 14 different specialists to rule everything else out, because I didn't want to think that I knew just because I read something. Because TSW mimics a lot of other things. You have this history that, you can corroborate, but there are other things that look bright red. I mean, even some types of cancers. I mean, I hate putting that out there, but you have to rule everything out when you have blown up lymph nodes and the whole thing. So that was something that I did. But just to wrap up what I was saying before was sometimes, the patient-doctor relationship, I just feel like we have to build trust. And if you don't have trust, you might need to find another doctor. Dr. Leo always says that he tries to meet people where they are. And I think that's the kind of medical provider you need. Like, what are you comfortable with? That's okay. But you do need someone to help you navigate infection and all of these things, depression that come along with it. You need proper medical care. And if you're really getting this pushback, this adversarial relationship, it's okay to go elsewhere for your care. But it's important to get care.
Thank you so much. We have a question for Dr. Marvin and Dr. Peter. Is it possible to use Protopic and Elidel during TSW, or can these creams also cause a similar withdrawal? That's a great question.
Peter, you're on first. Go ahead.
Well,
1 second.
Thank you. Well, I was waiting to hear what you were going to say, but I'm curious to what you think, Dr. Rapaport. But I think that, we've heard reports of people describing a similar rebound type effect or a similar addiction with both of those drugs. My sense is that in general, the chance of that happening is lower than it is with steroids. So I do feel that some patients can successfully use them, but I'm definitely aware that there are other people who say, no, I got in the same kind of bad cycle. We wouldn't expect it to be exactly the same because they're not working on the nitric oxide system. They're not working on the blood vessels in the same way, but there may be an immune aspect to this whole thing that we don't fully understand. So I kind of leave it to my patients, and I've inherited some patients who say, I don't want to go back there and we have to go to a different direction.
I'm very pragmatic, very realistic, and not that smart. Dr. Leo is much smarter than I. This is very simple. Peter, they rebounded they had red face paper on Dupixent. They were rebounding from the cessation of the steroids. It had nothing to do with Dupixent. It's got nothing to do with any rebounding from Elidel or Protopic. They're rebounding. Look at Lauren. She still rebounds. So if she ate oatmeal last night, she could blame oatmeal was the cause of the rebound. Has nothing to do with it. It's all the steroids. It's so simple. I don't understand why everyone tries to make it complicated. It's all the steroids. It's a vascular phenomenon. It has nothing to do with any immune system or anything. These patients, luckily, Lauren, you are not involved internally. Of the 6,000 patients I've seen, none of them had any problem except 5.
The National Association, the National Eczema Association has a position on topical steroid withdrawal. And if so, what is that? And if not, how do you see that happening?
Yeah, no, I'll start by saying I can't speak, for the National Eczema Association. I'm not a spokesperson, nor am I the CEO, so we'd always want to check with them directly. But as a board member, I'll tell you my impression of it. Yes, they've been actually really supportive of it, and I think they've, I will say that a lot of it's thanks to Kathy. Before, I think there was this sense that there was some antagonism, that it was almost like they were angry with NEA because the National Eczema Association still does talk about steroids, and there was this sense that it was not compatible. But I really feel like we've made great inroads. And I mean, for me, it's one of those situations too, where we're trying to get the message out. And I think if you're too extreme, then people just tune out. So if we're really, truly trying to make change, which I legitimately am, I want to fix this problem deeply, as does Dr. Rapaport. As you've heard, he's passionate about it. I feel like, again, we have to kind of meet everybody at a certain point. So I think this more gentle, holistic, slower process is, again, it's not the right thing. I wish we could just turn it off right now and get everybody on board, but I think it's working. So I think National Eczema Association has really embraced it. Lots of different information pieces on the site. It's coming up regularly in all of the different education materials as an important aspect. And again, there are some people, I think, who say it's not enough. And it's hard to argue. I can't push back, but I can say that there's something, which is really exciting.
Well, thank you. That is encouraging. Oh, yes, Kathy, please go ahead.
Just wanted to add to that. This past year, National Eczema Association has added a TSW hub onto their website. They've published a really great paper, like education piece on TSW. and they are letting us speak at their eczema expos. And this coming in July, I'll be there, and I was there last year, and I believe former President Kelly Barta had presented before. So we have definitely made like inroads, and I've heard personally, you know, in 3 or 4 different professional settings where doctors will bring up TSW and then bring up National Eczema Association even says blah, 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 you know, like, so that has been huge in making us more credible and legitimate and getting a wider audience. So, so that's been really great. I also just, not to, you know, start anything, but there is a protopic Elidel withdrawal group, and they have never used topical steroids, some of them, and they are seeing some of these same symptoms. So I just wanted to bring that up. So it is hard to differentiate if you've been on topical steroids and protopic, like which thing is happening. But there is a small crew who only did protopic, and they're seeing some of this. And so, you know, that's just something else to consider, to put out there.
I would also like to add that there is a little bit of hope. I know Marvin's frustrated that the doctors aren't recognizing this, but 44,000 plus people have watched the film. And that means if there are 2 people sitting there, 80,000 people have watched it. And if their families have watched it, it might be over 100,000 people. I know as a filmmaker, when you get 40,000 eyes on anything, the word spreads. So you might not be hitting the doctors that you want, Marvin, but the common people who are going to go into the doctors are going to question this. And I think I understand your frustration, but I want to encourage people to continue to have people watch the film, because it says what Marvin is trying to say and what the Dr. Leo is trying to say. So
that is very helpful. Yeah.
I'm glad I got the opportunity to make it. I think it's very, very important. And the last people who are going to come around will be the doctors, Marvin.